Constipation while on a weight loss diet is a pretty common issue, particularly with low carbohydrate diets. Often, the problem disappears once your body gets used to your new diet. But what do you do if it doesn't go away? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Let's go over 3 common causes for constipation and take a look at some solutions for each. 1. You don't have enough bulk to create good stools. Soluble fiber is the building block of any poop. If your diet is low in soluble fiber, your body won't be able to create the bulk needed for a stool, leading to small, hard stools. And increasing your soluble fiber intake may help bulk out your stools. You can try eating more vegetables, prunes, blueberries, chia seeds, or whatever else is high in soluble fiber and allowed on your diet. Sometimes, simply eating more veggies is not enough. For one, more veggies is relative and subject to interpretation. More veggies to someone who never eats veggies could still be far below the recommended amount. Also, it can be hard to track how much you're actually eating every day. So if you don't like worrying about all of that, consider just taking a soluble fiber supplement. Soluble fiber supplements are also known as bulk laxatives and can be helpful for this type of constipation. Using things like Metamucil, Benefiber, or Cognac fiber can work well. Just make sure you're drinking plenty of water during your diet as well, or it may constipate you further. Soluble fiber only works well if there's enough liquid. 2. The content of your stools are too hard. Although some constipation is caused by a decreased intake of liquid or soluble fiber, or just an overall decrease of food in general, some diets, like diets high in protein, may create stools that are just harder to begin with. These stools may be bulky and already have a good size to them, but are rock hard and tough to push out. In these cases, trying to use more soluble fiber to deal with it may not work as well, since the stool is already large but simply too compacted to deal with. And adding even more bulk to a hard stool is a good way to get hemorrhoids. Try using a stool softener or an osmotic laxative instead, something that will soften, break apart, or pull water into the stools. Taking something like Restoralax, Docusate Sodium, or some magnesium can help soften your stools and make it easier to push out. 3. Your stools are sitting in your bowels for too long. Even diets seemingly higher in soluble fiber can still result in constipation, since weight loss diets often slow metabolism, and the resulting decrease in activity and gastric movement can cause the stools to sit too long in your bowels, resulting in harder, drier stools. In these cases, stimulating bowel movements can help push stools out faster. Increase your physical activity if you tend to be sedentary, as this will help increase your metabolism and can help get your bowels moving. Using stimulant laxatives like Dulcolax, Senokot, or castor oil cause your bowels to temporarily contract more vigorously and push the stool out. Although it can be very effective for many types of constipation, I don't recommend using these for long periods of time since your body builds a tolerance to these, and you'll have to use larger and larger doses to achieve the same effect. So if you're going to use them, try to use them for short periods of time, or only as needed. It's rare, but some people get unusual side effects from stimulant laxatives, like confusion, irregular heartbeats, muscle cramps, skin rashes, or discolored urine. You'll need to immediately see your doctor if you experience any of these symptoms. If you do decide to use some of these laxatives, make sure you take a note of these few things. 1. If you have other medical conditions such as high blood pressure, cardiovascular disease, or diabetes, or are taking other medications, make sure you check with your doctor first, as laxatives can possibly aggravate certain health issues or interact with medications. 2. Constipation can be potentially caused by other rarer but more serious health issues. We've only looked at constipation caused by dietary changes, as might be seen in a weight loss diet. So if you've been dealing with severe constipation for a long time, or suddenly get constipation that's not related to a change in diet, you'll need to see your doctor about it. And 3. If you've tried everything we just talked about and constipation is still an issue for you, your constipation may not be related to the content of your diet or the consistency of your stool, and you'll have to go to your doctor to see if there are any other potentially more serious causes for your constipation. Do you experience constipation while on a weight loss diet? And were you able to resolve it? Let me know in the comments down below. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.